Dr. John Trowbridge. He received his medical school degree from the School of Medicine at Case Western Reserve in Cleveland, Ohio in 76, and completed a general surgery internship in 77 at Mount Zion and Medical Center in San Francisco, California. And in 1978, he established a general medical practice here in Humble, Texas, and where he started using nutritional interventions and how it impact chronic degenerative diseases. He's also served as chief medical consultant to a firm remediating Houston metro buildings with compromised indoor environmental quality, including problems with toxic mold exposure and asbestos. And in 2014, he was awarded a Distinguished Lifetime Achievement Award from the Integrative College of Internal Medicine. Just to tell a story about Dr. Trowbridge, he had heard about a friend about a Tony Robbins seminar soon to be in Houston, and a really messy event. So he and his friend decided that they needed to go, and there was something called a fire walk event. And he thought, well, why not? And so his seminar partner, they went to the assigned 20-foot path of coals, hot coals, and they each walked across without incident. So they concluded that maybe they walked on a cooler path. So then we stood in line to walk each of the other 3 lines of the glowing coals, again finishing them all without incident. The moral of the story is that opportunities have suddenly shown up throughout his life, some more challenging than others, and when he's jumped in with both feet, he's often been rewarded with unexpected accomplishment. Anyway, Dr. Trowbridge.
Thank you. Am I live on this one? Good. Everybody here? Good. Thank you. Okay. Forward, backward. Okay, good. I want you to notice how easy it is to clear out a lecture hall. And the bad news is that this is what they proposed that I should talk about. But since Dr. Wolfson was here, I'm going to go ahead and talk about my other great passion, which is chelation therapy for heart disease and all the other things that we do for heart disease. And all those folks are going to miss it. Isn't that crazy? All right, by disclosure, I should tell you that I published the yeast syndrome book in 1986, for which I still get a nickel a copy royalty, whether I need it or not. And another book called Sick and Tired this year, for which I pay $4 a copy in bulk to get it. So just to let you know. So let's talk about why we die. You know, hurricanes are pretty vicious, and people do die from them, even though we have all this advance warning and supposedly prepare for them. And this is the kind of scenario that it looks like when a major storm can hit. We have accidents that kill us. And of course, there's all these crazies on the road. You're not one of them, but there's crazies on the road and they nail us. We have catastrophes that nobody can really plan for. Those certainly kill us. Operations have their risks. You know, people say, well, you know, that's kind of my last choice. And I go, no. You need surgery. It's number 1 on the list. You don't need it. It ain't on the list. Illnesses can kill us, and it's surprising how many people miss the opportunity to easily take care of an illness that could otherwise have deadly consequences. Medical treatments can have deadly consequences. As much as we wouldn't like to admit it, we all have to stay on our toes to avoid that. You know, because that's our job. First, do no harm. What about no treatments? Yeah, no treatments when you need medical care or surgical care can be pretty deadly. But structures can be why we suffer and die. Structures that get buried in water. Structures that have lots of creases and cavities on the inside that we don't see, but they're most definitely there and have been submerged. How about houses that have been underwater? You know what underwater is for a house, right? 1/4 inch. 1/4 inch. In fact, that may be an excessive amount, Because the moment that your floor is covered, it's going up the walls. It's now in your structure. And this is a common picture of what we had with Hurricane Harvey and what, the folks in Florida, New Orleans, Puerto Rico, Cuba, and so on suffer with. And this is not uncommon at all. Maybe the garage is separated from the house, but look what's in the garage. And don't forget, we stored all sorts of things that we're going to try and rescue. Here is one of the problems with our structures. Everybody knows that's a weep hole, right? That's to allow the humidity that collects in the wall to be able to get out, or the water that's coming up from the yard to get in. So it wouldn't be quite obvious that the structure behind the wall has actually been exposed. Here's another great place, the sill. That's where all these pieces come together and water can seep right in between them. Do you know that water will always find its level? It's very interesting, okay? I don't care what you think, it was tight and water will not get through. I have on my house a leaking gutter, okay, that I've sealed over repeatedly and still leaks. Okay, so water gets through. Here's what neighborhoods look like in Houston. Neighborhoods. This wasn't the only storm, it's just the most notable storm that we've recently had. Buildings, office buildings all over town have suffered. And what's inside them? Offices. Now, as much as we'd like to think that we have fully remediated these things, remember I did have a little bit of experience with this, we'd like to think we fully remediated these. We didn't. And that's because we needed to get back to work. We had to do it hurriedly. We thought we did it well. But what about the cabinets that are installed in the room? Did we take them out and clean behind them? Did we take them out and actually check the structure of the cabinet itself? One of my friends is a master bricklayer. His wife noticed that they had a leak under the kitchen sink. It had become rather extensive in terms of its damage. The simplest way for him to take care of it was to take the brick wall off behind the sink, fix it where he could get to it, and then put the brick wall back in place. I'm sure you would go to YouTube and find how to do that, right? But these cabinets can be deadly. Now recognize that construction techniques mean that we have a flat surface called a foundation or floor, and we have all these uprights going up. And there's a junction between them. In other words, those flat base plates are sitting down there. What do you think can accumulate under them? Moisture, water. So when I say 1/4 inch, what I'm talking about is the whole house has now been soaked in an opportunity to grow fungal organisms or bacterial organisms. That'll work too. How about we just used a metal construction technique? That's okay. Those are all crevices into which water can creep. We suffer and die because we have opportunities for wiring and other such fancy devices to be uncleanable after they have been soaked. In other words, you can take a Q-tip and go all the way through and get all of that, and I don't think you will. How about wonderful things like this, often found in industrial areas, where those cabinets are pretty thoroughly mounted, and you know how they clean them out, right? Open them up, rinse them out with something, and that's pretty well clean. Yeah, clean this. And these are often in the basement areas or far away from what would seem to be human habitation and such. Every one of those crevices can become a challenge. Here's some good challenges. Anybody see any of this during Hurricane Harvey? Because you go, oh, I'll never get the car out of there. No, you will. And they'll clean it off and they'll clean the garage and we'll go on. Except when things like this happen, how far do you have to haul the car? Anybody remember we had about 1 million cars damaged in southeast Texas? Damaged means water sufficient to get to them to require some sort of remediation. How about, is this real or fake news? Well, the title of the talk is Hurricane Hell 2022. Well, that's several years from Hurricane Harvey, and I think that's really important because what if what I'm saying is right and nobody notices what's coming? And what's coming is an opportunity for us to suffer. And a very common phrase when a doctor doesn't know the solution to your problem, if it's not a referral, if it's not a solution, he says, you have to learn to live with it. Well, the problem is not that you have to learn to live with it. You're already doing that. What you'd like to do is learn to live without it. But what if it's misdiagnosed? Because you see, you're clueless when you go to your doctor. I don't know, I've got this problem. You're hoping that there will be a proper diagnosis and a proper treatment, but you don't know where it's coming from. I mean, it's kind of strange, some of the stuff that I find out what's coming. But there might be a solution. There might be a solution to many problems, which we're going to talk about, and that involves the three great kingdoms. You know, the United Kingdom, Russia, the Vatican, I don't know, whatever. So that's not it. The three great kingdoms, and I want you to remember this, are the plant kingdom, the animal kingdom, and the fungus kingdom. Oh, fine. You laugh at the fungus kingdom. It'll get you back, okay? Now, plants make energy. In other words, we're bigger than the plants, so we eat the plants, okay? Animals are bigger than plants. They eat them. Animals are bigger than other animals, but plants make energy. And we get these sequences of digestion of the lower species. But really, who eats whom is the question. Plants make oxygen, they make sugar, they make, all the vital nutrients, the vitamins and such that are minerals that are concentrated there. And animals eat those plants to get what they're after, the nutrition. Animals eat other animals. Fungus eats plants. Fungus eats animals. Trust me, nothing personal, just business. You look very much like a wonderful animal to the fungus. The fungus is the king above all, okay? Because it's the one that eats the other two. So which one do you think is smarter? Well, the fungus has to be real, real smart because it will either survive or die. So every bit of defense that you put up, it has to get around. Now, there are fungal disasters. You look at this and you go, it doesn't look like too much of a disaster. Just a patchy spot of a fungal thing. And there's another one, a little bit of psoriatic type pattern. And there's a fun one. We every once in a while get to see those. Usually we see much less of a degree of that, and often we don't see it at all because we don't ask people to stick their tongue out. Have you noticed that really we train in a medical system now that really doesn't require patients, it just requires reports, okay? So we're going to treat the test regardless of the patient. If they stick out their tongue and they go, is this a problem? And you go, probably not. And the answer is because if you don't have the solution for it, and there are fairly readily, easily solutions for it, then they can progress and then the patient gets worse. And that's kind of what's going to happen. Here's a fungal disaster. It's called gingivitis. And what do? Surgery. Okay. A mechanical approach to a metabolic problem. Interesting. Here's another fungal disaster. Chronic tonsillitis. People come in, I keep getting it. Well, have you ever heard of coexisting infection? One is treated, the other is enhanced. Antibiotics encourage the growth of fungal organisms, and you get repeat episodes. There's a fungal disaster, chylitis. Okay, people have that, you got to start looking at the old people. Yep. And they go, yep, what? No, I was just looking. It's very simple. A little monostat cream to that twice a day, also helping clean up their diet and stuff, but that painful irritation goes away. Here's one. You have to be a gastroenterologist to get to see this. That's pretty impressive. Mostly they miss fungal involvement in the esophagus because it's not near as prominent. It doesn't show up as well. Here's one we can all see, onychomycosis. And you go, well, it can spread. Yeah, it gets to be intertriginous, yeah. But really, is that serious? Is that a problem? For that patient it is. There's all these areas in which human beings as animals are prone to get high humidity infections, and most often those are fungal. And they have a wonderful bacterial component because one invites the other in. Okay? We're starting to get closer to the disaster level here because, you start getting something like this on the foot that nobody can treat. Now you're starting to talk about a mechanical solution to a metabolic problem. We cut it off. Do we cut things like that? Oh, all the time. Why? Because we haven't been able to fix it. Now remember, the solution is the right diagnosis and the right treatment. If you fail to have the right diagnosis or the right treatment, incidentally, the most important part of that is the right treatment. You may have the wrong diagnosis but accidentally fix it. That's okay too. This person was not so lucky. Neither was this one. Onychomycosis is more than just a cosmetic problem. This came out of the Archives of Dermatology. It spreads to other sites. It's a portal of infection for bacterial infections and can lead to more severe problems, cellulitis, gangrene, and so on, in high-risk patients. What's a high-risk patient? Well, they're diabetic or they have kidney failure. Okay, fine. Does metabolic syndrome qualify as a high-risk patient? Yeah, I guess maybe we want to look at it that way. What about anemia of chronic disease? Does that qualify as a high-risk patient? Yeah. Okay. Are we asking our patients to take their shoes and socks off? Because the onychomycosis is more than a cosmetic problem. It's a breach. Now, I want you to remember New Orleans. New Orleans was doing fine until one tiny breach of the system protecting the city. The levees were fine, the dikes were fine, everything was fine till we just had a break. And what happens to that break is it extends. And that break is what I want you to remember for people, because everywhere we have a tissue change, it's a transition or a margin that is effectively a breach in our defenses. And we are able at that point to become easily infected. Eyes, nose, mouth, everywhere we have a change in the tissue. It's no longer the same stuff. It's a breach. Now we could gloss that over and just go into ignore mode because, if you know how to treat it, then why bother to find it? And indeed, it's so easy to treat because it's the signals of what's coming down the pike. How about this fungal disaster on the inside? Now, do breasts get infected? Highly glandular and vascularized tissue, can they get fungal infections? Absolutely. I'm one of those people who thinks that most of the things that are treated fairly aggressively at other centers nearby can actually be treated much more effectively as fungal invasion. Not a popular thought, but I'll tell you how much it works. Here's a nasty thing from a kidney, fungal invasion. How about this from a brain? Cryptococcal meningitis. That's what we go looking for. That can happen deeper in the brain, investing those tissues in such a way that you can't have a surgical solution. And often the drugs are not good enough. How about inside the bones? Again, that challenges our ability to do a solution. You know what a fomitic infection is, right? That's one that comes on a non-living surface and you touch it and the infection was sitting on it, okay? So fomites can transfer things, but by the same token, it's very hard once something gets embedded on a tissue inside you. It's very hard for your defense system to really take care of that completely. It has a hard time reaching it. If you've got an implanted joint, it's really hard for things to get treated and taken care of. So let's talk briefly about what is an infection. I'm sure this is a quick review for you. Viruses, bacteria, and fungi. But what is a syndrome? I want you to notice the collection of round things here. Collection of round things. That would be like a round syndrome. When you are a pelican and you are hungry, you go whoop, scoop, and you get a bunch of different fish. Do you spit out the species you were not looking for? Nope. they will all do just fine, okay? So this is just a collection of fish. So they don't necessarily have to look the same like a round syndrome, but they just have to kind of be in the same category so that pelican is fine feeding on fish. And what then you start to look for is cause and effects, because a syndrome will lead to certain effects if you understand the syndrome. And I'm going to talk about yeast. Yeast are fun because they're cute little buggers. They're kind of like you'd want to take one home, adopt it, and raise it with puppies and whatever. They are, however, very, very nasty. They are in the kingdom above all others. Yeast and fungus, mold and mildew. People want to talk, well, I don't understand the difference. There is virtually no difference, okay? If you're getting mildewed, you're getting yeasted, you're getting fungal and all that good stuff. This is the most significant part of modern medical practice that is ignored. The most significant part of modern medical practice that is ignored. If you don't believe me, go try to find it in the textbooks. Because we are the ones that suffer on the way to not understanding this is really happening. It is time to acknowledge the yeast syndrome. Of course, that is a sly little advertisement for my book from 1986. Okay? I'll let you know, I talked to Jansen about that time and said, hey, I could go around and talk to doctors and explain to them really how to properly use Nizoral, which was absolutely wonderful, ketoconazole, wonderful antifungal drug. And they said, no, that would be unethical to have a doctor promoting a drug in conferences with other doctors. Okay, got it. How do we get fungal infections? We get it by contact. Contact is easy and understandable. We get it from gum margins. That's an easy way for you to have an ingress. Okay, of course, we eat plants. Plants have fungus on them. That's an easy avenue because we have a breach potential at the gums. Contact can happen anywhere, which way and loose. Vulva is a rich, wonderful area for things to happen, and a lot of the I've got a urinary tract infection again is not that. It's really a fungal infection, either vulvovaginal or, urethral, periurethral, bladder, whatever. Deep dental is another great way to have a problem because people don't really understand dental pathology at all. You have teeth or you don't. And that's a pretty simple medical view, isn't it? You got teeth or you don't. If you don't, let's hope we don't lose your dentures while you're here in the hospital, which we do. But anyway, the key is that we don't realize there's miles of tunnels through each tooth. Those tunnels are living, breathing tunnels. They actually have a pulsating fluid that is coming in and going out. It's flushing the tooth from the inside. It's healthy for the tooth until we start putting caps on it and this in it and drilling down in it, and then we kill the tooth by putting in root canals, which means we can no longer defend the tooth. Remember I was talking about those infections. This is kind of a fomitic infection. And we get a deep dental, a root-based infection, which can spread to other parts of the body. How about gut permeability, called leaky gut? And the margins of the gut are just primed for breaches. We can inhale things. Anybody hear the Houston crud? That's the chronic sinus stuff that everybody's getting. And the allergies and the this and all that. And my idea is that, Harvey has changed a lot of the inhalation dynamics around here with both mold spores and then other kinds of airborne things we're getting exposed to. They don't just stay in the sinuses and such, they can go down into the lungs. In other words, what I'm trying to say is every branch of medicine needs to be paying attention to the prospects that I'm going to raise. VOCs, volatile organic compounds. We think of these when we go into a fabric store and we smell that stuff, or the new furniture smell, okay, or the new car smell, okay. All these materials are outgassing things. Guess what else outgasses? Fungus. Okay, that moldy, mildewy kind of smell? You're literally breathing in organic chemicals they have produced. In other words, you're in an environment where that's being produced. By what? I don't see anything. Right. That's what I was showing you earlier. Anything that gets down at that level and can come up into the structure can challenge your health. And there are people who literally are, the yellow canary from the mine. They can't be in a room like that. They can't walk down the aisle where the cleaners are and such in the grocery store and such. These volatile organic compounds can be from fungus that's seen or unseen. Okay? Seen or unseen. It doesn't matter. They are serious and they are toxic. We don't get sick because we have genetic predispositions. We get healthy because of a lifestyle. Well, then if the idea is we get healthy because of a lifestyle, then we would get unhealthy because of an unhealthy lifestyle. That's not always of our own choosing. It's not always the foods we eat or the supplements we take or the exercise we do or don't do or the other illnesses that we have. It can be because our environment that we are constantly returning to every day. Could it be the car? You ever get in a car? A little odd when they turn on the air conditioner. Think on that. You walk into a room, into your house. I had one lady who said, I realized that I didn't do well on that end of the house. And I went into the bedroom that we never used there, and I opened the closet, and she said there was a greenish gray film on all the clothes in the closet, from the water leak from the top of the roof coming down to the ceiling to that closet. Now, I, of course, informed her this is a hazmat situation. She says, no, I took all the clothes out. Oh, okay. But you really have to do, negative pressure. You got to have hazmat suits. I mean, to do this right, to really clean that area is going to be toxic forever unless it's properly remediated. Would she recognize that? Of course not. We're all pretty clueless about this. Antibiotics have made us sick. Why? Well, because they're valuable to treat bacteria, but when you reduce the number of bacteria, you can increase the number of fungi. Birth control pills, because that's hormonal alterations that we're not familiar with. How about cortisone, other hormonal operations? Now, a lot of these things are now available over the counter, like the steroids and such. So we don't have to depend upon our doctor to make us sick. How about food fake news, food fake, and all that stuff? The food triangle, was founded upon banking dollars. Damn it, that banking dollars thing always comes out. It was founded upon people who make a massive fortune selling you crap. What's that? Sugars and starches. Now, not all the sugars are bad, not all the starches are bad, but most of the ways that we get them are. Because when you read the label, it doesn't say just plain sugar or just plain starch. It's this and that and this and that, and I can't pronounce this, and I didn't understand that, and I didn't know what that was. And so, have you read the labels on these things? Get a Twinkie or a cupcake or something, set it in your cupboard. And whenever you get hungry, you can always go back. Months later, years later, you can go back because cockroaches are smart. They ain't going to eat that. They read the label. And they have been to a different school than you have. They know what those words are. So the basics for healthy eating are really quite the opposite. Okay? Remember Dr. Atkins, Bob Atkins? Okay? High protein, high vegetables, not much else. You know what? He was right. And that's actually the paleo diet. You want to know where paleo came from? This is kind of a funny story. So I was doing some videos with my friend Doug Kaufman, who has a show on TV. And I said, Doug, so why did you steal my dietary program? He said, did I steal it? And I said, well, phase 1, phase 2. He said, oh, gosh, I really did then, didn't I? He said, I'm sorry. And I said, oh, it's okay. Because he wrote books on yeast and stuff. He said, I got a funny story for you. And I said, what's that? And he says, I got a call a few years ago from this guy who said, I'd like to steal your diet. He said, well, okay, why? He says, because I think this really could help people. I want to call it the paleo diet. He said, that's a funny name. So, oh, sure, whatever. Boy, if I had been smart. you'd have not been talking with me today. I'd have been down in the Bahamas or somewhere else. Paleo is different than fast fake foods. Paleo is different than all these kinds of things that we encounter. How about stress? Does it really matter? Sure. It contributes to every one of those diseases. Dr. Wilson was talking about this, all these different diseases because they're all based on inflammation. And inflammation is based on stress. And incidentally, infection is a major stressor, especially infection with fungus. Poor sleep lowers your immune system, which means if you have a fungal problem, you're likely going to keep it because your immune system has been compromised. If you don't have one, you're more likely to get it. Common health habits get us in trouble. He's really in trouble because, you know what, his insurance expired last month. But that's okay because that's grist for our fodder here at the training center, right? Okay. Fungus can't be that bad. I mean, I'm sure. It's just a nuisance, mostly a nuisance, right? How about the risks can be surprising? The risks can be very real, and they can threaten your health and your life. I mean, do they really? I mean, if they really did, wouldn't we have heard about it? You know, my dad asked me in 1981, he said, I'm thinking about going to this doctor to get this thing called chelation. And he goes, well, tell me about what he's planning to do. And I said, oh, Dad, you know, I know about that for certain things. I said, but, you know, if that were really any usefulness, I would have heard about it in my medical schooling, in my journals, in my training, in my continuing education. I want you to stay away from him. Okay. So I ended up training in chelation therapy a year and a half later and started teaching it the year after that because it is phenomenal for getting people better. The risks are very real when your doctor doesn't know what treatments are available that might be absolutely critical for your well-being, and that will threaten your life and your health. Aging and acidosis. Anybody know that acidosis really is something that we should be correcting? Because that's a metabolic challenge to our survival, the function of all the tissues and the immune system support, as well as protection against infection. Hypoxia, sleep apnea. That's an interesting situation because it's related to all these different diseases that are associated with inflammation and fungus and so on. Hypoxia-related diseases, malignant tumors, heart disease, wound healing, arthritic joints. I mean, it just keeps going and going. So there are two certainties that we know of in life. One is death, the other is taxes. We're working very carefully. The taxes are getting better, but we soon will have death under control. But there's really three certainties: death, taxes, and fungus. Remember, the fungus is designed to eat the plants and the animals. That's the only way it can survive. So, if you're talking about cell injury, which is aging, you know, aging is a disease happening one day at a time. If you're talking about cell injury, which is illness developing inside us, every one of us is developing something that is going to kill us sooner or later. Hypoxia, right there, infectious agents. Infectious agents. We're talking about fungus, not so much bacteria. Incidentally, we're talking about viruses and parasites and a few other things like that. But fungus is primo because it's designed to eat us. And don't forget that we're now in an environment where 6,000 to 8,000 new chemicals are introduced into the environment every year, all of them thoroughly tested and approved by the EPA. Right? Now, we can't even get the drugs appropriately approved, so that 4 years after marketing, they have to be black boxed and then removed. Do you think that these poisons damage our immune system, not just to develop something like cancer, but also to develop infections? Absolutely. Here's what pesticides can affect every part of your body. And of course, we're going to get pesticides in all those foods. And that means your immune system as well. You are going to be the result of an invitation to fungus, thanks to all those pesticide damages. The only line of defense is your immune system. It's the only line of defense you have. So the question that I have to ask, we look at all these different diseases, and we go, boy, you're sicko. Is it really that you're a sicko or that you have a fungus? that's just taking advantage all over inside you. You know, my patients don't come locally, I can guarantee you for that, okay? My patients come from a great distance because they've already been to all the other specialists. I mean, the average is 12 to 24 doctors that they've seen. And they're still sick and sicker. And I look at it, and every organ system has something, and it's just kind of like this slide. Are they sick with all these different things, or with one showing up in different areas? And the fungus is what explains it, because they get better when I treat them. Fungus jumps on us and in us. Opportunistic mycosis is a fungal or fungus-like disease occurring in an animal or humans with a compromised immune system, like candidiasis. That's the standard yeast. Aspergillosis, cryptococcosis. Hey, there's a whole bunch more that you can't say and I can't pronounce. So, you know, the deal is it's opportunistic fungal infection because they're trying to eat us. Their job is to recycle us. But understanding these complex cause and effect relationships is kind of hard. A single event or situation can have many possible results. Not all of them are equally significant. Any event can have more than one cause, and identifying those causes may be difficult. So, you know, do doctors have a diagnostic struggle? Absolutely. But it's worse. You do not look for what you do not know about. You do not look for what you do not believe could be a problem. You do not look for what you do not believe there's a good test for. You do not look for what you do not believe the tests need to be ordered. You do not treat what you do not find because the test wasn't done. In other words, it's complex if you don't know where to start for fungal illness. But putting the facts together makes it a whole lot easier. Harvey has presented us with a generational apocalypse. There's no two ways about it. This is serious. Why? 1 million cars? You know, we still have patients who haven't moved back into their house yet. There's still people who've been relocated to hotels and motels and apartments and whatever. I mean, we got people who lost everything. One of my patients said his friend was 69 years old and said, well, we don't have any cars, we don't have a house, we don't have any clothes. We don't have any of our furnishings or any of our properties. I don't have a job, and we still have the mortgage. It's like being 19 again. And I thought, you know, how better to say it? This is a generational apocalypse. 20 years from now, Houston will still be recovering from Harvey. But 5 years from now, we're going to be really faced with the consequences of massive contaminations. Those houses are getting cleaned up and sold. You know that. Some of them are even getting bulldozed. Kind of depends on whether they really needed to be hazmat bulldozed, because that can spread all that fungal stuff throughout the neighborhood to arise again at a later time. These guys are smart. You have to remember, water equals fungus. Water equals fungus. If it gets wet, it can start fungus, and they can sporulate. They can quietly sit there. They get wet again, they come back up. It's not easy to do remediation on fungus. Water equals fungus. I would encourage you not to buy a used car that has a really good price tag on it. There might be a reason, because all those crevices we talked about are important. Remediation failures. This place was remediated, and look at it now. That's because of what I talked with you about for the construction issues. Fungal toxins maim and kill. Fungal toxins are not something to go, well, you know, we'll send the infectious disease doctor, who incidentally will not see your patient unless they're in the hospital. Okay, whatever. But fungal toxins maim. In other words, they create illness. They bring you down. They can kill you. Volatile organic compounds can come from the strangest places. Anybody have a water faucet they just can't get to stop dripping? Water equals fungus. It gets very hard to deal with those sink areas. Let's talk about pinch points. Anybody recognize this as Houston traffic? My slogan is, if you build it, they will park. But what you have to think about is pinch points. It only takes a few. In other words, you don't have to stop 3 million cars in Houston. Just put 20 cars in the correct intersections, and everything will back up. That would be like your body getting sick from just having fungal infections in a few spots here and there. But the neat thing is, you don't have to fix all 3 million cars. Get those 20 critical ones out of the way, everything will start sorting itself out. And that's what I do when taking care of patients, find out where are the critical fungal issues, get those under control, and then support the body rebuilding the damage that has already been caused by the fungal toxins, and everything gets better, and it can get better literally within 2 years. Now, I say 2 years, but actually, I ask my patients for 100 days for them to really turn the corner and feel better, because that's how easy it is to get them relieved from the stress of the fungal toxins consistently banging on their systems. What systems are involved? Any and all. The whole panoply, the whole cornucopia of what goes on inside your body can be affected by fungal toxins. Any and all symptoms. In other words, one starts and they all follow. It's just right in line. You know, my nurses will tell me, got a good one now. I haven't seen him yet, new patient. They already know. I mean, they've been with me for, 20 years, 28 years, whatever. We see this all the time. It's so predictable, it should be teachable, which is wonderful. I got this invitation to come down here and speak. The only other medical audience I've addressed with this is the New Mexico Osteopathic Medicine Association meeting, in 1988 or something like that. They were really enthralled. They just were great. And because doctors don't know, we will have a tidal wave of suffering in 2022 here. Why? Well, the patients will get treated just wrongly. The patients will get diagnosed because we have phenomenal diagnostic equipment as long as you have insurance. Okay? But that tidal wave of suffering will be because the diseases keep on coming. We treated you for this, now we're treating you for that, and we're treating you for this other, and your friend comes in, and da-da-da, and it's just going to go on, and we will miss the combined infections. People get infections with bacteria. There's no question. I mean, antibiotics and anesthesia are the two greatest advances in medicine, bar none. Okay? Bar none. The best ever, because we can do things we could have never thought to do. Well, why don't we think about combined infections and treat the fungus as well? That's our little trick for stopping the recurrent urinary tract infections, the recurrent sinus infections, the recurrent bronchitis and such. Very easy to stop if you treat the combined infections. Really, those infections that get started and don't get adequately treated early on, that's the beginning of the end. That's the beginning of the final change. Now, it won't be necessarily so obvious. It's called a tipping point. And you can tell when someone is older and falls with a broken hip, they don't really go back home and they end up in the nursing home. Obvious tipping point. Everybody would buy that. The beginning of the end. My grandmother only spent 9 years in the nursing home, whatever. But the subtlety of yeast infections, because you know what? When people start talking about the number of specialists they have, beginning of the end. They've got illnesses that are not being handled in each of the symptom areas. Now, close counts and horseshoes, close counts and hand grenades, close counts and shotguns. Close don't count with yeast. You have to ask yourself if what you're doing today is getting you closer to where you want to be tomorrow, which is a better diagnostician and a better therapy doctor. Okay? Now, have we taken the wrong turn? I mean, some doctors seem to be clueless about this. I know because I try to talk to them. Some doctors disregard what I have to say. And you know what? If they don't have an experiential base to understand it, that's fine. Some doctors ignore what I have to say. Those I want to sucker punch. But anyway, I don't. Because, I thought all of us should learn a little bit more today to help us tomorrow. Some doctors treat wrongly because they're just TV doctors. Has anybody seen The Good Patient? No, not The Good Patient. The Good Doctor? The Good Doctor TV show? Isn't that awesome? I binge watched it over the holiday. But anyway, some doctors treat minimally. When I say that, they don't understand something like the yeast syndrome, which needs continuing treatment to keep the yeast at bay while we're building up the damage done to your system. Some doctors create new disasters because, cortisone is a treatment for everything you don't understand. And indeed, patients will often feel better while they're getting worse because cortisone encourages the growth of yeast. Are we taking the wrong turn when we say, I did what I knew how to do, and I still do that because I don't know anything different? Have we taken the wrong turn when our good intention is to keep doing what worked before? Well, it didn't really work because the patients are still sick. Real treatment works. Real treatment is on target. Real treatment saves lives. The choice is yours. You can go left or right. I would just go right, vote early, vote often. But anyway, are we facing the hurricane hell of 2022? I think we are. And the reason I say that is because if people don't really understand, accept, diagnose, and properly treat yeast-related illnesses, then they are going to get in trouble. It's easy. I wrote a book, explained most of it, 1986. I will get a nickel a copy for everyone you get. It's easy, Sick and Tired, came out this year. Great book, even if I say so myself. I've been blazing the trail on this since 1983. It seems frustrating that so few people understand it and do it. However, the situation has changed with Houston. We have a generational apocalypse. It is going to be an overload of our medical systems with all the simple things that keep recurring because they're really the yeast syndrome, inadequately treated. And that's the neat thing. We're pioneering solutions now that really can make a huge difference in patients' lives. And you can be on the front line of doing it. Because life's risks are real. I mean, when we're seeing patients, you just have a sinus infection. That can become extreme. Well, maybe not this episode, maybe the next one, maybe after that, because people get sick over time. And those risks are real, and the risks of our failures are terminal. So if we're going to hold ourselves out to be good, caring medical people, we have to know what we're doing. Our duty is to learn and do. Knowledge is power. I would strongly encourage you to think about whether or not fungal infections like this can be that serious. Our slogan in the office is find it now, fix it right. Now might mean it's been delayed for years because nobody ever saw it. Fixing it right means finally fixing the underlying condition. You guys have been wonderful. Thank you very much. I appreciate it.
Thank you, Dr. Trowbridge. Now we'll take some questions.
I answered all the questions. There aren't any questions.
Questions?
See? Told you.
No one? Yeah. Okay.
We've got one up front here, too.
Yeah.
So we've got
one
two.
at the back.
Do I hear three? Do I hear three? 3.5. 3.5, 4. That's a good question. I kind of said to myself, let's see, Harvey's 2017. People are going to be struggling and doing all sorts of things, and they're probably going to be highly motivated getting back to work and whatever and struggling, getting back in the house. They'll dismiss a few things. They'll maybe go in and have a few illnesses and such. But as this stuff percolates, both in their structures, their houses, their cars and such, and in their world, they're going to start getting more and more medical treatment. Antibiotics, cortisone, and so on. They're going to expose themselves more desperately to the yeast. And that's when I kind of picked arbitrarily. I think I'll be right. And you can ask me next 4 years from now if I'm right. Thank you.
So what approaches do you recommend in terms of supplementation? I'm back here.
Oh, yes, okay, I see.
In terms of supplementation, do you support the liver with N-acetylcysteine or detox? What's an intervention that you would start with for toxicity from mold?
For yeast?
Yeast or
okay, every patient is different, and I think a strong support for their basic underlying systems is essential. So obviously a multiple vitamin. Obviously vitamin C to the level that they will tolerate, bowel tolerance, okay? magnesium because they're generally so deficient in magnesium. That's one of the characteristics of the yeast syndrome, which incidentally is a correlative to high blood pressure, arthritis, heart disease, and so on, anxiety and all the other depression and stuff like that we often see in the yeast syndrome patients. And then it depends on what kind of gut support needs to be done, because if you don't fix the gut, you'll never fix the yeast syndrome. And so we start just kind of with the general support, and then we start looking more specifically for what I would call the general things that happen with yeast, and then the more personalized one for that particular patient. And I got to tell you, inflammation. So any kind of anti-inflammatory you can plug in is going to be helpful. Not drugs. Anybody else? All right.
We have one more.
Sue.
Hi, thank you for your lecture. So you had a slide on the projector about an acidotic environment in your body. So are there foods or diets that can create an alkalotic environment that would be beneficial?
The most alkaline environment you can create is from vegetables. Now, doctors often say fruit and vegetables, but fruit has fruit sugar. If you have the yeast syndrome, you might, accidentally be encouraging the growth of that. So raw vegetables, and after that, more of those. I have a different view than a lot of other doctors do about the intake of meats and eggs and things like that. And I don't find them harmful at all. And we get all of our patients into a wonderful ketoacidotic state. And that ketoacidosis is very promotional of an alkaline environment inside. And so, I've been doing this a lot of years and just haven't seen issues. The more vegetables that people will eat, the better. Thank you.
Are you recommending steps for people who flooded in Houston to try to get rid of this? Because it's going to keep hurting us if we don't get rid of it, right?
That's a great thing. First of all, getting rid of it in your environment means exiting the environment if you really didn't get it cleaned well enough. When we were doing mold remediation, we would spray down with the bleach and everything like that, and spray down and remove any structure that we had to and so on. And our final spray was the next to final spray was with a purple dye, just food coloring, okay, that we could see everywhere that we had treated and make sure we got it. And if there were any points that we had to go back and just soak any further. And after each soaking, you dry it thoroughly. I mean, you've got to get that stuff in there and dried, okay? So that's your environment. In your car, I don't think you can remediate a car. I think it just goes, okay? And that's, if you look at all the creases and crevices in a car, how are you going to clean them all? And then in terms of your personal body and stuff like that, vitamin C, strong multiple vitamin. Probiotics, I think, are extremely important. We're learning a lot more about how critical they are. And then just a general health review as to whether there's anything else going on with you that needs to be looked at. And if SpectraCell was here, they have a phenomenal nutrient analysis. And if you look at that and you go, why am I low in this? Got to be an answer. Go find the answer, because that's going to help keep your immune system strong. Remember, the thing that protects you is your immune system. So what you have to do is keep that in good shape. Also, look at breaches. I mean, you don't want to have gum disease. Periodontitis is so easy to fix. It's a yeast syndrome problem. So you get people treated for the yeast that's pestering in their mouth as well as injuring their body. They don't need surgery. Everything just gets better. So, fix that potential breach, fix any other breaches on your skin and your nails and such like that. In other words, boost yourself back up. And avoid stupid stuff like being a lumberjack, in the middle of the swamp or something like that. I have friends who do that, but anyway. Any other questions?
Yeah.
Great, yes.
After rebuilding foundation, and if people still have problems, do you use long-term antifungals?
Great question.
Prescription or supplemental?
Great question. The process that I developed over the last 35 years has been very simple. You start people on nutritional things that discourage the growth of yeast. You're kind of squeezing these yeast down because you don't want to hit them very hard right off. It's kind of like if you have a wet sponge that, you just kind of press on it, then the water comes out and kind of evaporates. But if you hit it with a sledgehammer, it splatters. So when you hit them too hard right off, their symptoms just dramatically worsen. It's called die-off reaction or Herxheimer reaction. Not something patients will go through. Trust me. Okay? So we developed a way of nutritional things. Then we use one of the azoles, ketoconazole, diflucan, whatever, okay? And we kind of introduce them into bleeding the yeast to death. And then shortly after that, we start using nystatin, which is a nice way of, disrupting their membrane system for a long period of time. And they may be on nystatin for a couple of years, okay? As they get better and better, we're looking at reducing dosages and increasing dietary challenges and such. Now, the ones who aren't getting better after that, we're looking at what I call deep blood fungus. I didn't talk about that in this lecture, but there's an absolutely phenomenal thing now that the lab in Phoenix has discovered, FryLab, F-R-Y, if you want to contact them. FryLab in Phoenix has taken blood samples and documented genetic SNPs from fungus in the blood. And of course, we can't have that because, septicemia will get you and all that stuff. Well, the thing is we think there are nests of deep blood fungus. We think there's nests of this that arise when you get sick, okay? Because we're finding it in patients with rheumatoid arthritis, lupus. It's present in the blockage in coronary and other arteries. It's present in patients with MS, ALS, worsening kidney function, diabetes, this whole panoply of illnesses. And you go, must be that there's a signal as you're getting worse that your body is understanding, oh, I'm struggling, and the yeast goes, well, I'm here to help, which means I'm here to recycle you. And interestingly enough, there's a dozen fungal organisms that are unusual, okay, that have been found. 6 is kind of the primary players. One of them is like the almost major player in this. It's a plant fungus. And you go, okay. And that's why I think maybe gum or gut breaches are significant, or maybe we're just born with this as part of the complement as soon as we get breastfed or whatever. We don't understand this at all. Let me just go there, okay? We do know that when we take patients who are resistant to treatment with the yeast syndrome, the easy stuff, and we hit them exceptionally hard for their deep blood fungus, and I mean it's combination treatment, different antifungals, antimalarials, antiparasitics, these people dramatically get better. And that would include people who have neoplastic changes that have been given up on by their chemotherapists and such like that. You go, well, why would that be? I mean, for years, I've taken high PSA patients. I trained in urology here at Herman. I've taken patients since about 2001 and treated them with high doses of antifungals, and their PSAs just quietly come down. And the urologists go, well, I don't know, it looks good to me. Well, I think it looks good to them too. Deep blood fungus could be the answer, and we're treating it all wrong? Uh-oh. One of my friends said that we'll never find an answer to cancer because there's too many people making a living off of it than dying from it. One of my other friends said that the reason chelation therapy will never be well accepted for heart disease is because it would cause a severe economic dislocation in numbers of the specialties in medicine. And you look at that and you go, God, do we really have to follow the money? Maybe we do. I don't know. Great question, though, because deep blood fungus is very challenging and exceptionally rewarding when we find those and treat those. Good question. You've been a great audience. Thank you for staying. Oh,